Hi everyone, this is Kate Warnock coming to you from the GuideWell UST Global Innovation Center here in Lake Nona. I'm very pleased to bring another wonderful guest here. This is Dr. William Flood. Dr. Flood, welcome to the interview.
Well, thank you very much. Thank you for this opportunity.
Oh, glad to have you here. So Dr. Flood is the Chief Medical Officer for Nant Health. So Dr. Flood, Nant Health, and particularly your CEO, Patrick Soon-Shiong, is known for disrupting the world of cancer. Where has Nant Health decided to focus these efforts, and how's it going?
Well, I think Patrick's goal, his long-term goal, is to construct a nationwide virtuous cycle of learning, where we can provide the best diagnostic information, use that to guide subsequent treatment choices, whether they're on study or off study, then collect those outcomes on study or off study, and do appropriate machine-based learning to feed back into a positive loop. So to that extent, Patrick has worked to put together what we think is the most comprehensive genomic and proteomic diagnostic test that can be used to interrogate cancer cells, and then is combining that with a series of decision support tools and tools that can interact with EMRs and EHRs to both give that decision support and to import that information about the patient, but then also to pull out the outcomes without double entry, without excess work for the providers or their networks. So I think it's that virtuous cycle of learning, starting with the accurate diagnosis of the cancer, that is his biggest contribution to disrupting cancer care.
So obviously, aggregating this sort of information and then making it an efficient delivery must be something that is so, I can imagine your audience, your users are just thrilled to have something that is so seamless and so well thought out.
Well, I hope so. I think the fact that we've developed this solution the way that we have is really testimony to the thought that Patrick put into this effort. This wasn't something that he came to out of the air. He really said, how can I change and disrupt our current medical care paradigm? And I think as a result of giving that such serious and comprehensive thought, he put the ducks in a row to construct this virtuous cycle.
So let's take a look at this then. With Nant Health, and again, that wonderful insight that Dr. Soon-Shiong provided when he developed his solution, can you name a barrier that's really standing in the way in really truly improving the cancer patient experience?
I think the biggest barrier is communication. Now, that communication can take on a number of different levels. So if we're talking about communication between providers and patients, it's the fact that providers are pulled in so many different directions that they may not always feel they have the time to give the patients, or the patients may feel the providers aren't giving them the time and the emotional energy they need to make this the best experience for the patients. The providers also have to deal with so many other issues aside from just the patient care. They have to deal with EMRs and EHRs that are more built around data collection and billing than they necessarily are in improving my ability to take care of the patient who's in front of me.
Right.
And then I think there's also a third level, and that's communication between EMRs, EHRs, or across networks. Cancer patients in particular get their care at multiple places. They may be getting their care at this primary care physician, they're seeing this medical oncologist or this surgeon or this radiation oncologist. Ideally, maybe they're all in the same network, but they may not. And then they go for a second opinion here or there. So those are all opportunities for communication about the patient to be lost, and then that data either has to be put back together or tests have to be repeated, et cetera. I think it's creating a comprehensive ecosystem for communication. That's probably the biggest single barrier.
I think that you really mirror a theme. We've had many of our wonderful participants here from the Greater Than Cancer Immersion event, and that's been a very common theme, the communication. And it's interesting that you layer in, it's not just the human communication, the face-to-face, it's the digital, it's the interoperability issues that continue to just be that stumbling block to really having that efficient care.
Absolutely, and again, those are the stumbling blocks that distract the provider from that one-to-one interaction with the patient. And so anything we can do to really make healthcare more of a system rather than healthcare as a individual practice where you may have to sometimes feel like you're reinventing the wheel because you don't have the pieces from the other places, will be very, very valuable.
I have another question for you, Dr. Flood. As an oncologist, where are you most hopeful? You personally will be most hopeful about change about the cancer patient experience for providers in particular.
Well, I think the providers it needs to be easier for them to deliver quality care. There are so many challenges for a provider in terms of things that draw on their time, that distract them from that moment with the patient. So we've talked about IT systems or new practice models that can help the doctor be able to spend more time in that room and focused on that patient. But that needs to be incentivized through new reimbursement models or new methods of practice across the multi-specialty group. That way, when I'm talking to you as the patient, all that time is about you, and less of it's about worrying about finding data,
right.
Pre-auths or coordination. At our conference this week, there's been a lot of discussion about navigating. And anytime that the doctor is doing logistics, which is valuable, but you're not doing it with the patient, that's pulling you away from that patient-physician interaction.
Yeah, so again, there's efficiencies in care to really enable the physician to practice the medicine he's there to practice.
Absolutely.
That's a great end game. One last question for you, Dr. Flood. What do you think will have the greatest impact on the cancer experience in the next 5 years? So Nant Health especially looking so far ahead.
Right.
I'm curious to hear this answer.
Oh, I truly hope that the biggest difference between now and 5 years from now is better diagnostic tools to better deliver patients with the treatment that's most likely to benefit their tumor. So, right now, when we think about the efforts that are underway across the country, there's two that come to mind. One is the Cancer Moonshot, the government piece. So, Vice President Biden is coordinating this government-wide effort to try to address some of the logistical or infrastructure issues that interfere with everything we've discussed. Increasing interoperability, the ability to bring in big data, analyze it, identify best outcomes, or be able to segment patients into what treatments benefit those subsets of patients the best. In our kind of commercial side of the Cancer Moonshot that Nant Health and our Nant families are participating in, we also are bringing two pieces to that. One is the diagnostic piece with our GPS cancer test, which we think is the most comprehensive genomic and transcriptomic and proteomic assay for determining and identifying best options of treatment for a patient based on their actual tumor biology. But we're linking that up with a clinical trials effort, looking at novel therapies, targeted and immunologic therapies. So I'm hopeful that the ability to really identify best treatments for a patient, whether it's based on big data or it's based on direct tumor interrogation, is what's going to allow us to better individualize the patient for that patient who's right across the table from me.
So my question was, it had that 5-year time. How is it going to take 5 years for us to get there?
Well, the goal of the Cancer Moonshot is to get 10 years of progress into a 5-year period.
Yeah.
And so I think that is a big goal, but I think big goals are what it's worth striving for. And so it's going to require a lot of work. And getting back to the issues we talked about, communication, there's a lot of inertia that's built into the system. And so I think with dedicated people and resources, hopefully we're going to hit that 10-year improvement in 5 years.
Well, with Dr. Soon-Shiong at the helm of Nant Health and yourself as the Chief Medical Officer, I think we have real reason to hope that we're going to accomplish those big goals.
Well, I think Nant Health is blessed with both inspired leadership, but also both inspired and inspiring employees or associates. I'm the Chief Medical Officer for a small piece within Nant Health, with Gary Palmer being responsible for the entire medical piece of our company. But we're really fortunate that Patrick has brought together such a strong group of people that share that vision.
That's terrific. Well, Dr. Flood, thank you so much for spending your time here with us today. My name is Kate Warnock. Thank you for watching.